building a better Bay Area for a safe and secure future. This is ABC 7 News.
I'm Kristen Z. Welcome to our daily program called Getting Answers. We're asking experts your question every day at 3 o'clock to get answers for you in real time. Today, we'll break down and talk all about the spike in COVID-19 in California and Governor Newsom's orders to close some sectors again, the first sign of rolling back since businesses started reopening. We are discussing this with the chair of UCSF's Department of Medicine, Dr. Bob Wachter. Dr. Walker, great time to have you because there's a whole lot to unpack here after the governor's orders today, a sweeping order really. So before we get to our interview, just run this through real quickly with our viewers. Governor Newsom has ordered closures in some sectors for the counties that have been on the state's monitoring list for at least 3 consecutive days. There are 19 of these counties, and the ones closer to the Bay Area are Contra Costa, Santa Clara, San Joaquin, Solano, Stanislaus, Merced, and Sacramento. These counties have to close indoor operations at the following: restaurants, wineries and tasting rooms, movie theaters, family entertainment centers, zoos, museums, and card rooms. As for casinos on tribal land, the governor says he's working with them and we'll have an update soon. As for the 4th of July weekend, all parking facilities at state beaches in Bay Area and Southern California will be closed. The beaches themselves will remain open, but the state will close beaches in counties where local beaches are closed. State parks will remain open everywhere, and Governor Newsom says do not gather with people you don't live with and avoid crowds. That in a nutshell. All right, right now, UCSF Dr. Wachter, thank you for joining us. Good to see you again.
My pleasure. Thank you.
So before we get to why these particular activities and businesses are being curtailed, let's understand what realities compel the governor to act now. What is California's COVID situation by the numbers?
It's not great. We were doing so well until about 2 or 3 weeks ago, but we have clearly seen a major spike, and it's a spike in case numbers. It's a spike in hospitalizations, and it's a spike in intensive care admissions. And so, and it's an increase in the test positivity rate. So hospitalizations, ICU admissions, and test positivity rate all went up by about 50%. So any thought that this is due to more testing has gone out the window. If it was just more testing, you might expect to see more cases, but you'd see a lower test positivity rate. You wouldn't see more hospitalizations. So these are people, some of whom are getting quite sick, sick enough to be in the hospital and sick enough to be in the ICU.
All right, so we were doing pretty well for quite a long time. What was the turning point? Can you pinpoint who or what is responsible?
Yeah, it's hard to say any one thing. The numbers would say that we were gradually increasing through May after we began opening things up. And that's not a critique of opening things up. It was expected that as we began to allow more normal activities that there would be somewhat of an increase in case rates. And part of the reason that it was good that we had 3 pretty benign months was that we were ready for that. We have more capacity, more testing, more PPE. More contact tracing. Things really started to change and surge starting about 10 days ago. And so if you look at the way the virus plays out, that probably means a week or so before that is when things started getting out of hand. So that's kind of Memorial Day and the next 10 days after Memorial Day. And what happened then? The bars opened up, but it may just have been the sum total of things becoming a little bit more open. People just going out and saying, you know, California's been pretty good so far, and I don't see a whole lot of cases around me, and I don't know anybody who's gotten really sick or who's died. It's okay for me not to wear a mask. It's okay for me to hang out with my pals. And so rather than this all being about one particular thing that happened by the state or by the counties, I think it's probably the sum total of a lot of individual decisions made by 40 million people, and that sum total has led to a big surge right now.
And again, not a criticism, but is it possibly also a factor? Does the data suggest it is also a factor that there were huge outdoor protests this past month?
It really doesn't. I mean, it's certainly a logical thing to wonder about, but when we've looked at the impact of the protests, not only in California, but all over the country, it does not seem to be associated with a spike. Now, that may be a little bit, there's an interesting research question there, because clearly some people got infected at protests. On the other hand, we also know that while there were protests, a lot of people stayed home. And so it may be that those things kind of cancel each other out. I think it is pretty clear that the protests did not lead to a large part of the spike. They also tended to happen a little bit before the time course that you would say is associated with a spike that really began surging in mid-June.
All right. And if the video we saw, certainly most people were wearing masks. Okay, let's talk about the order today. Why these particular activities? What is the common thread? I notice indoors, of course, but you tell us.
Yeah, I think that's the most, the common thread. The sort of uber thread is we have been opening in a graduated, incremental way, and we've been watching carefully each step of the way to see whether we've gone too far. So the first message is, the answer is yes, we've gone too far. Too fast, who knows? It didn't seem unreasonable to do what we've done, but we now learned it's not working, and so we've got to scale back. And so the first thing you scale back are indoor activities. One of the things that's become clear over the last 3 months is the virus spreads much more readily in enclosed spaces than in open spaces. It's not that outdoors is 100% safe, but if you're doing the same activity indoors versus outdoors, you're much, much less likely to catch it if you're outdoors. So it's an effort to scale back, but try to maintain as much of the economy as we can. And we'll see what happens. I think it now needs to be watched for the next week or two. And if it turns out we don't see those curves flatten again, I assume there will be more scaling back, and we'll start to lose some of the indoor activities as well.
Well, a couple of questions. All right. So if being indoors and in close proximity with others is a problem, then why not also ban gyms or hair salons? And then why ban outdoor bars, for example? So is this more than just weighing the risk? Maybe we're also putting value or importance on these things?
I'm not sure. I don't have an insight into what the governor or his health advisors are thinking. You know, all of those points are perfectly reasonable. I think they may have wanted a very clear message. I think part of what we have learned is the clarity of messaging and consistency of messaging is very important. I think we've kind of screwed things up on masks with early messaging that they weren't all that important, and certainly messaging coming out of the federal government that's been both inconsistent and often wrong. So it may just have been in weighing all of the factors to say, let's do it cleanly, and particularly right before the 4th of July. Let's think about about outdoor is okay as long as you're distancing and wearing masks. Indoors, less so. But why those particular activities were either on or off the list, I'm not sure.
Okay. I want to ask this, just come out and say, but if everybody wore a mask, do you think we would be crushing COVID? And is there proof?
The answer is that if everybody wore a mask, the rate of new cases would go down tremendously. It wouldn't go down to zero. There are, the masks are not 100% perfect, but they're pretty darn good. And the proof of, no one has done a study to randomize a city to, this city gets masks and this city doesn't. But the studies that now have come out of the United States, out of Italy, out of China, out of other countries, very clearly demonstrate that that higher rates of mask wearing are associated with fewer cases, fewer hospitalizations, fewer patients in the ICU. And there are also many other scientific studies that demonstrate, one just came out a couple of days ago, that shows that if you cough or sneeze, what's coming out of your mouth will travel 5 or 6 feet. And if you're wearing a decent mask, it will travel 2 inches. And as we know that in order to catch this virus, you need a decent slug of particles with virus to hit the back of your nose or the back of your throat. And so it makes all the sense in the world that if both you and the people around you are wearing masks, we would markedly decrease the rate of transmission.
So would it make sense? Would you support a federal mandate on mask wearing?
Absolutely. I mean, we should have had that a month ago or even more. And the problem with the mandates and mask wearing, I mean, there already is a state mandate on mask wearing. The question is enforcement. And I think the governor tried carefully to say we're not going to be going around arresting people who don't wear masks. but to say that we're going to be looking at what the cities and counties are doing, and maybe holding out the threat of funding cuts if people are not enacting rules and regulations that get people to behave better. It's a tricky thing to do. The real hope with mask wearing is, rather than somebody arresting you if you're not wearing a mask, that it just becomes a normative behavior. Think about 50 years ago when it was normal to go in a room and see everybody smoking.
Right.
It now would be incredibly weird to see that. And it's not just because there are rules and laws against it. It's because if you did it, somebody in the room would say, don't do that.
Right.
And
right.
we have to get to a place where people are comfortable saying to each other, you need to wear a mask, and I'm not comfortable going into this place if not everybody who's wearing a mask. It needs to become a normative behavior, and it has not become that yet.
All right, we're going to take a short break on the air. When we come back, we're going to talk to Dr. Wachter about what happened to the California miracle. But over on social, where you can join us right now on our live stream, including Facebook, I'm going to ask, who are the latest people getting infected right now? So join us over there if you want. All right, Dr. Wachter, we can continue this conversation for our Facebook audience. And that is, I'd like to know, who are the latest people getting infected and getting hospitalized?
Well, I guess the things we know in big categories, we know that the group getting infected now is younger than they were earlier.
Yeah.
And so, which is important. I think it's evidence, further evidence, that younger people who feel like they're at less personal risk to get really sick and die are engaging in more unsafe behaviors. We also know that there are certain populations at particularly high risk. The one that's very familiar to us in the Bay Area now is the unbelievable outbreak at San Quentin. And so there are certain congregate living facilities, whether it's in prisons or in nursing homes, that are beginning to get hit. But they've also seen outbreaks because of large family gatherings. It's not any one thing. It's just, too many people are acting in ways that are unsafe, that I think they came to believe that California did well for 3 or 4 months. So we're good to go. We can go back to normal. And it turns out the virus doesn't care that we had 3 good months. The virus is just ready to pounce if we let our guard down. And that's what it is proving to us right now.
Okay, so the governor says this order is in for 3 weeks, and then after that, it'll be reevaluated. So if in 3 weeks we're back to where we were, let's say Memorial Day, is that good enough to reopen those sectors again?
I think that'll be a tricky call because I think some of it will depend on whether he and his health advisors believe that if we open up again, we won't find ourselves back in this position. And some of that really depends on what the attitudes of people are and whether folks are being more careful than they've been. If the answer is things open up back again and we find ourselves back in the same position, then he shouldn't open up back again. We have to do everything we can to avoid this. Because right now we have not seen a big spike in death rates, but we are seeing a spike in ICU admissions and hospital admissions. And so death rates are just a week behind. We're going to start seeing a lot more death.
Dr. Wachter, we're going to come back on air. And we are back now with the chair of UCSF's Department of Medicine, Dr. Bob Wachter. Really good to have you here with your expertise in light of Governor Newsom's rolling back of some of the reopenings. You wrote extensively yesterday about what happened to the California miracle. We were sort of like the star pupil, right? We were one of the first states to get cases, but then we were one of the first to enact shelter in place and really get tough. We flattened the curve and kind of kept our caseload and our deaths low. In fact, so low, people thought, why are we giving up all our freedoms and social lives, if it's not really affecting us? Is that kind of what started the going downhill again?
Yeah, I think so. I do want to give us some credit for having done what we did. I mean, we flattened the curve for 3.5 months. That saved tens of thousands of lives. And I've heard people say, well, why did we even bother? Well, it saved tens of thousands of lives, and a surge now is better than a surge 3 months ago. A surge now is happening in an environment where we have more hospital capacity, more ICU capacity, more PPE, more testing, more contact tracing, and a couple of moderately effective medications, none of which we had 3 or 4 months ago. So I'm glad we pushed this back, but I would have been gladder if we never had a surge. And I think what's happened is pretty clear. I think people have let their guard down, got a little bit complacent, and came to believe that that was a New York thing. And somehow in California, we were immune from it. And it turns out it's just not true.
Mm-hmm. Well, I'd like to ask you, since you mentioned New York, as you know, now they have a quarantine for visitors coming in from California. And Hawaii, of course, had that quarantine, and they're going to stop it in August. There was so much pressure on them. In fact, the Justice Department was trying to, sue Hawaii to get them to lift. I was wondering if you think that states should just have the ability to, for example, ban visitors from out of state, or perhaps even counties, right? What if you say, oh, well, San Mateo is allowing indoor dining, but we're not allowing that in Santa Clara, so I'm just going to go over to San Mateo. The fact that it's different from county to county and state to state, does that help or not help us at a time like this?
Yeah, it's a tough call. I think it's reasonable to have county-specific guidance because, for example, San Francisco continues to do fairly well. We are seeing a bump in new cases and a bump in hospitalizations, but nowhere near what they've seen in Imperial or even in Los Angeles. And so locking things back down here in the same way that you're locking down counties that are being hit harder doesn't make perfect sense. On the other hand, we're all very connected. And the bump in San Francisco, for example, if you look at the hospitalizations, about half of the increase in our hospitalizations is coming because we're getting transfers of patients from other counties, including Imperial County in Southern California. The outbreak in San Quentin began with prisoners being transferred up here from Southern California. So it's a tricky call. We're all very interconnected. But I think the way the governor's handling it is right, to have statewide rules, to be watching carefully. And there's, from what he's done so far, I have no doubt that if San Francisco starts getting worse, we will be on that list along with all the others, and they will start locking us down as well.
So you don't think our decentralized decision-making system has kind of hampered us in a pandemic?
Well, I think it certainly has hampered us at a federal level. I think the messaging from the federal government on this has been awful. And the absence of a consistent message about how real this is, how scary it is, the importance of masking, the importance of distancing. I think that has gotten in our way because there certainly are people who still don't believe this is a big deal or don't believe that masks work. And so, we're all in this together. If other people are not wearing masks, it increases the risk to all of us. But some level of decentralization, I think, is appropriate. The rules that you would have had in New York in March weren't appropriate for California. We were doing so much better. And the same thing is true in reverse now. We are surging. Texas and Arizona and Florida are even worse than we are. And so what New York does today is going to be very different than what California does. And California is sort of its own country. California is so big with 40 million people that having a uniform set of rules in California is an imperfect solution. I think the way they're handling it, which is central guidance, central standards, but some flexibility at the county level seems like a reasonable balance to me.
All right, you were talking about the mixed messaging when it comes to masks. So today, President Trump is saying he would wear a mask. It's the first time he said something like that. He even said he likes the way he looks in a mask. Vice President Pence has started to wear one this week. I wonder if you think that is a big turning point in terms of improving the mask wearing numbers.
It's helpful. It's too little and it's awfully late. But it's better than nothing. I mean, we certainly know from surveys and from what we see on the internet and on TV that there are, a fair number of people in this country who believe deeply in what the president says. And if the president says masks are bad, they'll not wear a mask. And if he says now it's okay to wear a mask and you don't look bad if you wear a mask and it's a sign of strength and not weakness, then I have to think that that's a good thing and should increase the rate of mask wearing. And masks are really one of the most important things we can do. If we got to anywhere close to universal mask wearing, we would all be much, much better off.
All right. So one thing that the president had said, even recently, is that perhaps the coronavirus could just disappear. What have you learned from a scientific standpoint about this virus over the last few months that it's been with us? Could it just disappear? And what would it take for us to make it disappear?
The answer is no, it cannot just disappear. And I wish he would stop saying that. If he's going to move on masks, it would be nice if he moved on that one as well. There is absolutely no reason to believe that the virus is just going to disappear. The only ways that we are going to get out of this predicament are either an effective vaccine that's safe and that people take and allow themselves to get, or very, very effective treatment. And by treatment, I mean treatment that either prevents people from getting infected or makes it so unlikely that you're going to get sick that we really are not very worried about someone getting infected because they're very unlikely to need hospitalization or to die. So far, we've been making good progress on vaccines. And so I have a lot of hope that we will have a vaccine that's proven to be safe and effective, maybe by the end of this calendar year. The problem with that is then manufacturing hundreds of millions of doses and getting them into hundreds of millions of shoulders is not going to take a week. It's going to take many, many months. And so, and there's no treatment that has been demonstrated to be effective in anyone other than people who are already very sick in hospitals. And so it is not going to disappear. We're going to have to live with this. And I think what California has proven in the last couple of weeks is if you begin to get complacent and let your guard down, it's just waiting out there to pounce. And it does it very quickly, more quickly than I think any of us had expected. And so we're in this for the long haul. This may be another year that we're like this. And it seems like the minute you feel like you're doing well and you can let your guard down is the minute that your risk is going up again.
Yeah, we saw that in the past month. All right, Dr. Wachter, we're going to take another break on air. When we come back, let's talk about what it would take to reopen schools safely. And then over on our live stream platforms right now, we're going to talk a little bit more about masks, including your question on Facebook. All right, Dr. Wachter, we have Elena Nuzova, who says masks are not helping to spread this virus. Check the mask under the microscope and see the size of those holes comparing to the size of the virus. What can you tell Elena?
Well, all of the evidence says that that's not right, that the masks actually are quite effective in blocking the kind of particles that need to get through in order to cause infection. It's actually quite lucky in a way, a single viral particle, and she's right that the virus is incredibly tiny and can probably make it through a cloth mask or a surgical mask. But we know that a single viral particle will not get you sick. You need thousands of viral particles to get in touch with the back of your nose or the back of your throat in order to cause infection. Mm-hmm. And because of that, it does appear that masks are really quite effective, most effective if everybody's wearing them, if the people who are producing the particles by talking or singing or shouting or coughing or sneezing are wearing masks, and the people who would be the recipients of it are also wearing masks. When you do that, you markedly lower the probability that you're going to get enough virus through in order to cause an infection. Okay.
Hey, is there one vaccine? I know there are a bunch of trials going on that is particularly advanced or promising at this point.
Not really any one that I know of. There's the Moderna vaccine that's being tested in the United States. There's a vaccine being tested out of Oxford, England. There's several being tested out of China. So we've got a lot of shots on goal here, and I think it increases the probability that we're going to find at least one that's effective, and hopefully many. Because one wonders if the first vaccine that turns out to be safe and effective comes out of China.
Sorry, we're going back on air. Hang on one second.
My pleasure.
4, 3, 2, 1.
And we are back with the chair of UCSF's Department of Medicine, Dr. Bob Wachter. Thanks again for spending the time with us. One big goal for many Californians, myself included, is for our kids to be able to go back to school safely in the fall. When we say fall, though, that's really only 6 weeks from now. So is that realistic given where we are now?
Well, it's a complex set of trade-offs, and there is no way for the kids to go back to school and say that there is zero risk. I think, the American Academy of Pediatricians came out yesterday endorsing in-person school. And the reason was they're not naive, that they're not saying that there's no risk. They're just saying that the risk of keeping kids out of school in terms of the kids' education, their health, the health of the parents, the ability of the parents to get back to work. When you weigh that risk, it probably is higher than the risks in kids going back to school. There's a bit of happy news about kids. A lot of the things the virus has surprised us with has been unhappy things, but the one happy news is kids are pretty unlikely to get sick. They're pretty unlikely to get infected, and they're pretty unlikely to spread the virus to adults. None of those things had to be true. And if they were not true, if the kids often got sick or were super spreaders, then school would be out of the question. But because of those things, I think there is a way to send kids back to school, trying to do it as safely as possible. And we're not saying it's zero risk, but we are saying that the risks of keeping them home may be even greater.
What can we do now, between now and the start of school, to ensure that that can happen for our kids?
Well, ideally, the amount of virus in the communities where we live would be as little as possible. So I was more confident 3 weeks ago or a month ago than I am now, because now there's more virus around. So what the adults can do is act as safely as we can possibly act, so that the amount of virus to be spread around is as little as it can be. Other than that, it really is a matter of what can the schools do to create the safest possible environment. And that is the usual stuff. That is, that is as much distancing as they can muster. It is trying to have everybody wear masks where that's possible. It may not be possible in all circumstances. It's going to be keeping the rooms super clean. Mm-hmm. It's going to be cohorting kids, probably in groups where you stay with the same kids all the time and don't mix. It's probably going to be some mixture of online and in-person schooling. It's a whole lot of stuff the schools have to do on tight budgets. I don't envy them. But I think it is a reasonable thing for us to try to get to. And there's going to be some testing as well, because if we have an outbreak in schools, we're going to have to go to Plan B.
So I want to go back to what you mentioned about not having any data that suggests kids are super spreaders. I think we've all heard a lot about how, they're less likely to get very ill should they contract COVID. But I've heard from teachers who are very concerned, saying, hey, we're over 50 here and we're at risk. Are you saying the danger of the teachers getting sick from exposure to the children is minimal?
It's much lower than if another adult was sick and had the same level of contact. It's not 100% clear why that is. It may have something to do with a certain kind of receptor that kids don't have, that adults have, for the virus to take root. So it's the subject of a lot of study to try to understand. But the data are pretty clear on this. And again, this was surprising. This was not sort of a preordained at the beginning. It was a surprising finding that the kids are not only less likely to get sick, but the kids actually are less likely to spread the virus to an adult.
All right, Dr. Bob Wachter, always great talking with you and learning from you, especially on such an important day with UCSF's Department of Medicine. Thank you so very much.
Thank you for having me. Really
we'll
appreciate
right back.
Any commercial break?
All right, and I know you got to go because you have another engagement, but
it's a little crazy, yeah.
I think you got to go. Okay, thank you very much. Nice to see you.
It's always nice talking to you. Thanks so much.
All right, checking in with my producer, Eric. How much time do we have coming back in for our final wrap-up segment? Okay, and do we have time to go through them? How much time do we have? Oh, okay. All right, folks, this has been a really interesting conversation for me on this big day when Governor Newsom announced for California that we're going to put the brakes. In fact, we're actually going in reverse on some of the reopened things. So here are some of the Bay Area and Central Valley nearby counties that are on the watch list. Contra Costa, Santa Clara, San Joaquin, Solano, Stanislaus, Merced, and Sacramento. So in these counties, basically, no more indoor operations such as restaurants, wineries and tasting rooms, movie theaters, family entertainment centers, zoos, museums, card rooms, and all bars. So no indoors or outdoors for bars, and restaurants will have to go back to just patio dining, outdoor dining, things like that in those particular counties. And you'll note that it's not all Bay Area counties. It is Santa Clara, Solano, and what was the other one in the Bay Area? Help me out. Contra Costa. That's it. Okay. And so you can imagine one of the things we talked to Dr. Wachter about is, you might go to a different county then if you're looking for that kind of experience, and what that means in terms of the spread. So everybody, the message is ultimately wearing masks will help a lot. And if we don't want further closing down of activities that have reopened, then it takes a collective effort. Collective effort means everyone individually making the decision that gets us collectively towards that goal. So hopefully you enjoyed today's conversation. We're coming back on air.
8, 7,
Fan Win, love my look. Thank you. Very nice of you to say.
3, 2.
All right, folks, thank you so much for joining us today on this interactive show, Getting Answers. Hopefully you gained some insight from the chair of UCSF's Department of Medicine, Dr. Bob Wachter. We'll be here every day at 3 o'clock on air and on live stream answering your questions. World News Tonight is next. Take care. All right, Facebook friends, thank you for another great episode and your participation and engagement today. I'll see you tomorrow.